as expected, after such stimulating presentations, we have a few questions. And let me start with Mr. Denwood. You spoke about the open data, and we're interested in knowing, getting the answer for this question. Are the members of the public and media actually using the data that you produce?
Yes, they are. How can we tell? It's easy to say. How can we tell that? By the simple metrics around page views and the number of local newspapers, so our media trawler, which are quoting them as sources of their news stories. But also, I guess, really importantly, is around particularly on the progression dashboard, the fact that the two-factor authentication version is used directly by regional directors of public health to respond to the pandemic and call in new services or initiate local lockdowns, and we can see through their use of the progression dashboard. Absolutely the day-to-day use of it. So that's how we measure. And yes, both the public and journalists are using the sources.
Thank you. A question for Prof. Lee.
Yeah.
You mentioned the data-driven insights for crisis communication. Can you talk about some examples, please?
Oh yeah, so I think that one of the interesting applications for the data-driven insight for the crisis communication would be, say, analyzing social distancing practice. So some of the panel members already mentioned about the measuring population-wide social distancing behavior. So for example, every cell phone providers, they have for billing purposes, they collect cell mobility data. So you have your cell phone, you're associating with the cell towers, that records is always there. So you can actually start analyzing this kind of data to understand how the entire population is actually moving around. So that information can be actually used along with your policies. So say that you have policies about the new recommendation to the public, and through this data in real time, that you can actually see what's going on. At the same time, you can also use that information to inform public to see that these are what's going on. Make sure that people try to better persuade people through the data. So that's one interesting application that we can think of.
Lovely. This question for both of you. Although I think it's more for Prof. Lee, but I would love to hear Mr. Denwood also thoughts on it. You showed us the experience, Prof. Lee. Are there any other governments that are working on nudging?
Well, I think that many countries have been working on nudging, and some of the countries have the specific teams for nudging. I think that Tom knows much better than me. I think that in UK, there is a behavior insight team. It's called BIT. When I actually went to their web pages, and they've been doing a lot of interesting projects. And they do controlled experimentations, and before rolling out some of the crisis communication, they do thorough data-driven validation before they do that. So Tom, do you want to comment on that?
That's right. Yeah. So those are the behavioural insights team, which are part of the Cabinet Office in central government, and they've over the last kind of 2 or 3 years really driven kind of nudge techniques across government departments to kind of instill kind of government transformation. I think specifically within COVID, I can talk more broadly, maybe not directly about the nudge unit, but the behavioural response of citizens has been one thing which has been really considered, I guess, by all governments, and particularly the government in the UK. And I know it's the SAGE, the Academic Advisory Committee into the Prime Minister and the ministers consider kind of behavioural papers and behavioural responses as part of the overall decision making. So yes and yes in summary.
Great. So there's a question that we received from the participants just now. One of the public health challenges is misinformation. and they want to know your thoughts on how we can use technology to combat misinformation during pandemics.
Mhm.
Prof. Lee?
So I think one of the ways that we can deal with this misinformation is that so one of the ways that we can different countries have different sets of information, and one of my colleagues in KAIST, she's actually expert in misinformation propagation. What she found was that some of the misinformation actually propagates later in different countries. So I think that from the global perspective, that just collecting all this kind of misinformation and having a global registry of this misinformation, so that having a sharing network, so that we can deal with misinformation as early as possible, and through the different channels that we can reach out more people, so that we can to deal with some of the worst case scenario. Tom, do you want to add something?
Yeah, absolutely. Yeah. So I guess dealing with the misinformation is, first off, you've got to provide very clear, authoritative information for people to gravitate to and access in the first place, and and make sure that's unambiguous. So in the NHS, obviously with the NHS website and the 111 non-urgent call number, which are the very unambiguous sources of information if you're a citizen. And then just an example from the UK, where the Cabinet Office actually stood up a team specifically to respond to and take down misinformation around COVID, which wasn't helpful. So working with social media companies to dynamically take down source of misinformation.
Thank you. So we've seen throughout today's session, including ours, multiple examples of mobile apps in different countries. This question is for Prof. Lee. We know that those apps can be used to engage the public, but how can we persuade them to actually use it?
But that's a really good question. So we clearly know the benefit, but in order for to be really beneficial, then people need to actually install this application. So what I notice from the literature and human behavior is that when people try to actually decide whether they adopt this technology or not, often the time they do actually do cost benefit analysis. So if they think that it can be beneficial, then they will actually willing to actually install the application. But at the hindsight, like if there is certain cost, maybe it's the cost of the the user experiences, it drains the battery too much, then they think that the cost is too much, and then they stop using the application. And another cost aspect may be something related to the accuracy aspect. So, for example, like if you're using the contact tracing, then you have to think about accuracy, whether it has false positive and false negative, and if it is too many errors, then it's really hard to actually convince other people about that, because like in the end they will actually sacrifice their privacy, and they're willing to actually sacrifice their privacy, but for what? I mean, if it is not accurate at all, then why should I contribute? So these are all a lot of the issues that not only the technology, but user experiences. At the same time, some of the privacy concerns related to that. At the same time, the benefit. So I think that these are all satisfied, so that the people are engaged with the application, so that they're actually really beneficial to the entire community.
Mr. Denwood, anything on mobile apps and your experience?
Yeah, so I was just nodding at Professor Lee's point around, citizens need to have confidence in how the data is going to be used, where it's going to be stored, who will have access to it, and the security of their privacy. And I think that's absolutely the one of the key determining factors in whether someone is persuaded to use an app or not.
I think the last question is for Mr. Denwood, is around legal frameworks. This is great. We've seen the experience. People think that it's just, collecting data, organizing it, and presenting it, that that's it. Can you speak to the legal underpinning of all the experience that you presented today.
Right, you saved the best question till last there, haven't you? Legal frameworks. So I guess I did actually cover some of that in my presentation around the use of legal directions, and those were that kind of legal instrument was set up by the Health and Social Care Act 2012 in England and Wales, and the use of the COPI regulations, which were envisaged that they may need to be used. I think it was back in 2005 they were put in place. So we were very clear that we were working within a clear kind of legal framework around what we do. I think that's important for citizens to want to know that the governments which they elect or work with, are following the law of the land. Yeah, so we're very clear. We work with the legal framework. We make sure that the data is not disclosive in terms of open data, small numbers suppressed. That we have a disclosure committee to make sure that the data isn't inappropriate for what we want to use it for, and we have extensive cybersecurity testing before we put any of those open data dashboards live, including kind of third parties coming in and helping us test them. And all of that is ultimately about building citizen trust, and that the data about their care will be used in a trustworthy and appropriate way.
Thank you. Thank you both for such stimulating and interesting presentations. Your Excellencies, distinguished guests, ladies and gentlemen, digital health is here to stay. This might be obvious to say, but the truth is adoption of digital health was far from the mainstream till COVID-19, which brought it back to the spotlight, and for good reasons, as we've seen in today's session. We've seen how digital technologies change the landscape of nudging the public by novel ways of communication and interaction. We've seen also the experience of the NHS in England in using open data to keep the public informed, the impressive dashboard, and also how this is enabled by a policy and legal framework. I would like to thank the Riyadh Global Digital Health Summit Chair, Organizing Committee, for their efforts, the speakers for their impressive presentations, and also the participants for their valuable questions and discussion afterward. Thank you all.